Hi, I'm Dr. Nidhi Khera and I bring warm greetings from Apollo Cradle Moti Nagar. High-risk pregnancy. Now what is high-risk pregnancy? This is a situation in which because of factors either in the mother or the baby or the placenta, because of any of these, the risk of having complications in the mother or the baby are more as compared to in what would be in a normal or a low-risk pregnancy. Which situations would you categorize as high-risk pregnancy, or which are the conditions in which you would need to take extra care? There could be situations in which the pregnancy occurs at extremes of age, so somebody who is going through a teenage pregnancy at less than 18 years of age, or in which the mother's age is more than 35, are bound to have complications more than a normal pregnancy. If you have a load of weight gain, if the mother is very obese, or if she is malnourished and she is definitely undernourished, or if she has undergone some bariatric surgery, that also will need special implications. If the mother has been taking some substance abuse or has been taking a lot of alcohol or tobacco, then that also would have its concerns in pregnancy. But commonly what affects it is if the mother is going through some medical conditions or medical disorders, and these could occur in the form of, say, if she's going through high blood pressure, she's going through sugar, she has some liver related issues, some kidney related or renal problems, or she has some thyroid dysfunction, some infections that would have been before pregnancy or during pregnancy. With the rising trend of infertility and a lot of assisted reproductive techniques, multiple births or twin pregnancies and triplets are also on the rise, and again this is a set of group that needs an extra or a specialized care. So this also fits into the criteria of a high-risk pregnancy. Then if somebody has undergone previous surgeries, say she's had a previous abdominal surgery, or like what I said earlier, a bariatric surgery, then often this needs a definite extra care. Why do we segregate high-risk pregnancy? Because we feel that this is a group of patients that need to be identified, and they should be dealt with specialized healthcare providers who have been adequately trained and who are professionally skilled in their field. Because this group of women requires that extra touch or that extra care, both from the point of view of the obstetrician as well as later on after delivery. The baby also requires a specialized team of a neonatologist looking after these babies. So if you do fit into this, what is to be done and how is it to be done? The first and the foremost or the most important is everyone should ideally have a preconception visit, because for us as a layman it's very individual for us to assess what would be a high risk later on and what would be a low risk. So a good idea to begin with is to plan a visit to your consulting doctor before you start planning a pregnancy, because at that very visit your risks would be calculated and evaluated, and you would have a segregation of which side do you fit in. So that's the most important thing of a preconception visit. And then you may be given some medicines to start with before you plan a pregnancy, and of these folic acid is the most important. One should start taking folic acid at least 4 weeks prior to planning a pregnancy, because this significantly reduces the incidence of abortions and reduces the incidence of developmental malformations in your baby. The next comes, yes, if you do fit into the criteria of a high-risk pregnancy, then you need to select a proper place where you're going to book yourself for a delivery, where you're going to have your proper visits. You may require extra visits, so you will need to be more careful in your prenatal or your antenatal visits. You may require specialized care and specialized testing. What is required during pregnancy is a specialized monitoring throughout your pregnancy by a dedicated team. So you may require some extra visits, you may require some specialized or extra tests. The safe hands of Apollo Cradle are always there for you and always with you. Wishing you all a very happy and healthy motherhood, and hope you enjoy your journey with your tiny little ones and little bundles of joy. Thank you.